This video will serve as your guide for your sensation and tissue integrity competency. For this competency, you will need a Q-tip, a paper clip, and a safety pin, and your finger. Okay, so first you know that you're going to wash your hands and set up your area. After you do that, then you will go in and meet your patient and get ready for your treatment. Hi Haley, I'm Tam Fries. I will be your student physical therapist assistant for today. How are you feeling?
Good.
Okay, what we're going to be doing today is I'm just going to be looking at your foot and checking out, making sure everything is good, so we can proceed with treatment. Is that okay?
Yes.
Okay. So first thing I'm going to do is I'm going to look at my patient's foot and make sure there aren't any scrapes or bruises or abrasions, anything that I need to be concerned about. With the foot, you want to make sure that you check under the foot, between the toes, that kind of thing. Any area you're going to want to make sure you check thoroughly. Next thing I'll do is I'll check the temperature, and to make sure that it is equal on both sides, I'm going to use the back of my hand and simply touch both sides and compare them, making sure that they're about the same temperature. If there's any difference, then you might want to go ahead and document that. The other thing I'm going to do is I'm going to test capillary refill. To do this, generally you'll start with the nail bed, put some pressure on that nail bed, release the pressure, and wait to see how long it takes for the color to come back to the area. This can also be done on the skin. Apply some pressure, release the pressure, and wait for the color to return to the area. This should take about 2 seconds. If it takes any longer, then you may have an issue. The next thing I'm going to check is light touch, to make sure you can feel a light touch in the area. Okay? Could you hand me your hand, please? Okay, this is the light touch. You feel that?
Mm-hmm.
I may use my finger as well.
Okay.
Okay? What I want you to do is close your eyes and you tell me when you feel that touch. And say yes or okay.
Yes, 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 yes,
Okay?
yes.
You want to vary the rate and the area that you test in. What you want to keep the same is the same amount of pressure. As I said, you can use your finger for this as well. Make sure they're feeling in that area, and you can go back. What you want to make sure is that you're not depressing the skin, you're not making any indention in the skin when you're touching. If you do that, that is not a light touch. Okay, light touch looks good. The next thing we're going to do is sharp, dull discrimination. First, we will use a paper clip. We'll unfold that paper clip. This will be my sharp end. This will be the dull end. Haley, can I borrow your hand again? So we're going to do sharp, dull. This is going to be sharp, okay? This will be dull. Same thing, sharp, dull. Can you feel the difference?
Yes.
What I'd like you to do is close your eyes and let me know which one you feel, okay? Ready?
Sharp, 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 dull, 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 sharp, dull, sharp, dull, sharp.
For this test, you want to make sure that you vary the rate in which you apply the pressure
Sharp.
and which one you apply, sharp or dull. You want to vary those up. What you want to make sure is that the pressure is always perpendicular to the area that you're testing. Any angle in your test could change the sensation a little bit. Okay, so that we know we can do that with a paper clip. We can also do with a safety pin the same thing. You want to make sure that when you use a safety pin that you're not puncturing the skin, but that you give that sharp sensation. So Haley, this is going to be sharp, and this is going to be dull. Sharp, dull.
Okay.
Feel the difference?
Yes.
Okay, close your eyes, please.
Sharp, 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 dull, sharp.
Again, we want to switch it up a little bit. and we want to stay perpendicular to the surface that we're testing. Okay, sharp and dull discrimination look good. Do you have any questions about your treatment today, Haley?
No.
Okay, well, I appreciate your time. Thank you for coming in. Have a nice day. We'll make sure everything is documented.